Well, welcome to Quinnipiac University's COVID-19 vaccine community conversation, empowering communities, informing decisions. My name is Janelle Chisera, Dean of the School of Health Sciences at Quinnipiac University, and I'll be serving as the moderator for this conversation tonight. I can't believe I'm saying this, but this is the fifth community conversation in a series of webinars that we posted over the last year to answer questions and to provide you with sound scientific advice and data-driven recommendations so that you can make your own well-informed decisions. So we have come a long way since we first began our first community conversation. We had 2 vaccines authorized by the Food and Drug Administration for emergency use, that's Moderna and J&J, and we have 1 vaccine fully approved for those 16 years and older from Pfizer, and that vaccine, I believe, will be marketed under a different name called Comirnaty. It's also important to note that the Pfizer vaccine continues to be available under emergency use authorization for those 12 to 15 years of age. As of this past Monday, 173 million people are fully vaccinated in the United States, representing 52% of the overall population. In Connecticut, 65% of our population is fully vaccinated and 73% have received at least 1 dose. We are doing really well in the state with those over the age of 55, where on average, 85% are fully vaccinated. However, we still have some pockets of work to do, especially with those age 16 to 35, where the percentage of fully vaccinated falls to approximately 59%. When we first began our discussions way back when, we focused on conversations around COVID itself and the Alpha variant. I can't tell you the last time I heard the word Alpha variant mentioned, except when comparing it to the now predominant form, the Delta variant. With the rise of the Delta variant, the US is facing a COVID surge this summer and fall as the more contagious Delta variant does what it does best, which is spreads. Over 800 colleges and universities, more than 200 healthcare employers, and dozens of states, local governments, and school districts have implemented vaccine requirements. Some business and even restaurants have updated the old no shirt, no shoes, no service policy to a no mask, no vaccination proof, no service policy. The US is averaging approximately 900,000 vaccinations per day, up from about 500,000 per day in mid-July. A recent Axios Ipsos coronavirus index released Tuesday finds only 1 in 5 Americans say they're not likely to get the vaccination, the lowest level since the start of this index. The percentage of Americans who stand in hard opposition to getting the vaccine has also dropped to its lowest reported levels at 14% of US adults. The changes are particularly noteworthy among parents. 68% now say they're likely to get their children vaccinated, with only 31% opposing vaccinations in their children. So, what hasn't changed? Well, first, millions of people in the United States have received COVID vaccinations under the most intense safety monitoring in US history. Medical advice from national health authorities and the CDC still indicates that vaccines are incredibly safe and highly protective, even against the predominant variant, Delta. Also, please remember that what hasn't changed is that not everybody you come into contact with will have received the vaccine. So it is critical for everyone to do the simple things to protect one another. Follow scientific guidelines and recommendations. Get vaccinated, continue to wear a mask, wash your hands regularly, and avoid crowds. We are here today with a panel of experts to help address your pressing questions regarding COVID and the COVID vaccine. With the recent full approval of the Pfizer vaccine, talk of booster shots, rising Delta variant cases, and the return of students to school, I can't think of a better time to bring together our experts to provide clarity on these topics and to help answer your questions. I am so honored to have an esteemed panelist with us again here today, providing expertise in medicine, law, biomedical sciences, and nursing. We are so honored and happy to have a special guest with us today, Dr. Anne Deschel, who's the Dean of the School of Education, who's joining us for this conversation today. Thank you, panelists, and thank you, participants, for joining, and in particular for those participants who submitted questions up front. I know that you're here because you have questions and you have come to the right place. We have the experts here that can answer those questions for you. If you missed our previous conversations, please do visit the link that's provided in the chat so you can learn what we shared in those conversations in the past. We have added a table of contents to the videos so you don't have to listen to the entire conversation. You can use the table of contents to get right to your question. Panelists, please take a moment just to briefly introduce yourselves. Mary, we start with you.
Hi, everybody. I'm Mary Peterson. I'm a pediatric nurse practitioner, and I practice at Complete Pediatrics in North Haven, Connecticut, and I'm an assistant professor of nursing at the University of St. Joseph's.
Thank you, Mary. John?
I'm a professor of law at the university's law school and the founder of our Center for Health Policy and Law Studies.
Thank you, John. David?
Yes, good evening. I'm David Hill. I'm a professor of medical sciences at the Netter School of Medicine. I teach in the areas of infectious diseases, tropical medicine, and public health, and I'm the senior medical advisor for COVID for the university.
Thank you, David. Lisa?
I'm Lisa Kachara, professor of biomedical sciences, and I've been studying infectious disease and vaccine hesitancy even before the pandemic.
Thank you, Lisa. And Anne?
Hi, everyone. Welcome. I'm Anne Deschelle. I'm the Dean of the School of Education. I've been at Quinnipiac as a professor of reading language arts and elementary education for 20 years.
Thank you, Anne. Before we begin, I just want to go over a few important webinar points. First, this presentation will be recorded and available on demand shortly after it's completed with transcription. Second, we encourage you to engage with us by asking questions in the Q&A feature that's at the bottom of your screen. You can ask questions using your name or you can ask them anonymously. And finally, if you see a question that comes up in the Q&A that is relevant to you, you can upvote that question by hitting the thumbs up icon. That will cause that question to jump to the top of the Q&A box, and hopefully we can get to that question sooner rather than later. So panelists, welcome. Thank you so much for being here, and let's get right to this with a few opening questions. So in just a few weeks, we will be greeting the fall season with the autumn equinox. And this got me to thinking about the seasonal flu shot, in addition to boosters, in addition to vaccinations that are out. So now that the seasonal flu shot will be available, should we wait to get the flu shot until after we get boosters? Or can we get these at the same time? What is the guidance that's out there? Lisa, David, do you want, one of you want to start with this one?
I guess I'll go first on this. There's no reason to separate a flu shot from the COVID vaccine. So the message here is get your COVID vaccine if you haven't done that. And if you when the opportunity comes to get your flu vaccine, please do. I'll say there aren't many silver linings that have been associated with COVID. In fact, there really aren't any, but perhaps one of the benefits of us being careful about our respiratory viruses this past season, there was no influenza. So basically for the 2021 season, there were very, very, very few flu cases. So if we can continue our measures about preventing the spread of respiratory infections, all those things that Janelle outlined earlier, we will, do very well this flu season. So get your COVID vaccine and no reason to hesitate getting your flu vaccine.
So I want to talk about I'm going to switch gears just a little bit. I want to talk about the Delta variant. And one of the things that we know and that we've discussed previously is that viruses constantly change through mutation, and new variants of a virus are expected to occur. We know that sometimes those variants emerge and disappear, while other times new variants persist. I also know that many of us are probably aware of the Delta variant. Delta is a highly contagious virus strain that was first identified in India back in December. And since then, it has swept rapidly through that country and Great Britain before reaching the United States, where it is now the predominant variant. So I was wondering, Lisa and David, what do we know about the Delta variant? Specifically, is it more contagious? Is it more severe? How can we protect ourselves and those around us?
So we do know that the Delta variant is more contagious. So the Delta variant was not really seen in the United States until July. And then in July, it quickly went from kind of 5% of the cases to 40% of the cases to now it's pretty much almost all of the cases of the Delta variant. The original strain was not as contagious. And then we think about the Alpha strain, that UK variant, that one kind of had the ability for one infected person to infect about 2.5 other people. This one is somewhere up in that 6 to 10 people that it can you can infect from one person. So we make a lot more virus, we shed a lot more virus, and we have that ability to be able to infect a lot other people.
So,
yes, and I also think that there is some suggestive information that is more severe. Maybe it's selecting certain types of hosts, but I think the message here is that it is more infectious and it possibly could be more severe. So again, please be vaccinated.
great. Well summarized. So what about the vaccinations in the Delta variant? Are the Pfizer, Moderna, and J&J vaccines protective against the Delta variant? And in particular, is there any vaccine that's better than the others regarding the Delta variant?
So I think the simple answer is yes, the vaccines are protective. Are they as protective against non-Delta variant vaccines or viruses? It's not as protective against the Delta. So the reality is that over time, our immunity to the vaccines has waned a bit. And with the Delta variant, the vaccines are not quite as good, but they are very good against preventing severe disease, against preventing hospitalization, and against preventing death. So the message should be, yes, the vaccines are not quite as good against the Delta variant, but they are still give you decent protection, and they will protect you against the most severe consequences. So there's no reason not to be vaccinated because of Delta. You're going to hear that out of my mouth a lot. Please be vaccinated.
Great,
Lisa,
great.
do you want to add to that?
No, I think you summarized that well. Yes.
So I want to press on this just a little bit of a question I asked, and I understand that they're not as good, but they're protective against hospitalizations and deaths. But I do want to press a little bit about people who are wondering which, if I haven't gotten the vaccine yet, which one should I get? Is one better than the other?
I think any of the three of them are better than not being vaccinated. So we certainly know that all three will protect against severe disease and hospitalization. Sometimes people have a reason for wanting the Johnson & Johnson, since it right now is one, and so that has a certain appeal to other people. But I think the ability to choose allows people to feel like they're at least part of the decision-making process. And I think right now I would like to see people just get vaccinated rather than worry that one's a little bit better or not as good as one of the other ones.
I agree.
Thank you. Mary, I want to roll you into this one regarding children. So what impact has Delta had on or is having on people under 35 and in particular children?
Well, we are seeing more cases of COVID in the younger population, obviously because children under the age of 12 aren't even eligible to be vaccinated at this point. But younger children in general do not show as severe symptoms, even with the Delta variant. That's not saying that you can't get significantly ill from COVID as a child, but children are less likely to have the severe symptoms associated with it.
Okay, so there is some information out there that kids aren't affected as much, so maybe we don't have to worry as much about our children. Is that a fair statement, Mary?
No, we still have to be concerned about children. There are children that are considered, those long haulers that have issues following COVID disease, and they also can continue to spread, should they have be positive for COVID. So, they will continue to spread and into adults that are not vaccinated also. So it is extremely important that we get our children vaccinated.
Yes, and I'd just add that we are seeing increasing numbers of children hospitalized with COVID now. So as they are the most vulnerable group because they're not often vaccinated, we're seeing more and more children hospitalized.
Got it.
We're
Great.
also seeing differences between kind of the Northeast, where we have differences between kind of the Northeast, where we have higher vaccination rates, and say the southern areas where we don't, in that children under 12 are not getting it as often in our states, which kind of shows that our community immunity is actually working. Otherwise, you would expect to see children in both areas having the same rates of infection and hospitalizations.
Good point. Thank you, Lisa. Thank you all for that. I do
Well,
want to talk.
but we do know that the highest growing demographic entering the hospital for COVID treatment are children. So this is a really significant issue, and that is increasing regardless of geography. But of course, as Lisa points out, more in the South. But that is the most significant group increasing in hospitalizations and serious illness with COVID.
And
Thank you, John.
we're facing a group 12 and under that are not vaccinated. So it's a large number of children.
Great. Thank you all. I want to talk a little bit about how rapid the Delta variant spreads. And we've talked about masks at every conversation that we've had, and I want to talk about them again. So what types of masks should we be wearing? Is there efficacy for cloth masks, surgical masks, KN95? I see people wearing gaiters. Let's get back down to the facts of what should we be wearing now when it comes to masks, especially as we look at the Delta variant.
I'm going to let Lisa take that because she's an expert on masks.
So certainly, wearing a mask, we think of kind of layers that we're going through. We're, making sure that we're still, if we can be outside and not inside, we're getting vaccinated if we can. We're still trying to not touch our face. So the masks are just another one of these things that we can help to be able to prevent us from transmitting and receiving this virus. I think some of the studies have shown that some of the gaiters and some people that are kind of pulling the t-shirts up over their nose is not effective at all. So I think we do know that some things are not effective. But I think a surgical mask is still going to be effective. If I know somebody that is high risk and they're wearing a surgical mask, I will actually suggest they put a cloth mask over top of it. And the reason really there isn't layering, but it allows that fit to be much closer to the face. Sometimes a surgical mask can have big puffs of, where it's not touching our face at all. Where a KN95 mask is going to be much more fitting. Or if you happen to be in a situation with access to an N95, you kind of have even one more layer. But I think the surgical masks are fine. As I said, if they're not being worn properly, then put a nice little decorative cloth mask over the top of it, and that will just give you a nice form-fitting ability to be able to seal that in.
I want to add that there was a recent study published about a week ago in the Journal of Physics of Fluids, which are the droplets leaving the mouth. And the findings were what you'd think. From N95 down, the protection diminishes, but even cloth masks provide a significant protection that can be improved. But there's good scientific literature now about the effective prevention of transmission of the disease, even with cloth masks.
Right, and it works by not only preventing transmission from an infected individual, but preventing acquisition of the virus by a non-infected individual. So kind of the source and the target control. So masks aren't perfect, but added again on top of vaccination and masks are very good protection.
So it sounds like what I'm hearing is kind of multiple mitigation factors. Wear masks, a surgical mask for filtration, cloth mask for fit. A mask is better than no mask. But again, get vaccinated, wear masks, follow the guidelines, correct? Okay, I'm going to move on to booster shots because we have health officials are, I believe, what I last heard was they're preparing to roll out COVID-19 booster shots in the United States later this month. I believe it's toward the 20th. Third week in September. According to that plan, all US adults who receive the 2-dose vaccines are eligible for an additional booster of Pfizer or Moderna. So I have a two-part question here. Is there evidence that vaccinated people need a booster? And are the boosters safe? I think I want to start there with a few questions.
I guess to think about the safety part first, we definitely know that, receiving a booster immunologically, there is no, scientific plausibility that it wouldn't be safe. So we know from the point of view of safety, yes, if we think about just the fact that if normally if we get exposed to a germ, we make our own immune responses to it, we could see that germ, say, the flu many times over the period of the winter. So we're kind of getting boosters all the time, exposure to these germs. So the boosters are very safe. I think as far as, evidence, we have hepatitis B and we have HPV, which are a series of 3 to begin with. So maybe the fact that we see our immunity starting to wane indicates that 3 really should have been the series to begin with. There was just a session on NPR today, and they were saying, maybe we have to not necessarily think of this as a booster, because a booster was more thought of that it would be specific for a variant and be kind of a little bit different, kind of like we think about the flu vaccine being different every year, but just that maybe this should have been a 3-shot regimen, from begin with. So I think the safety data, we, shouldn't be concerned about at all. And from a booster point of view, if we could indeed make sure that we're not going to catch this virus, even if it's mild in somebody that has 2 doses, why not still do everything that we can do so that we're not somebody spreading it to somebody else?
I can add a personal testimony. I got my booster yesterday, went into a CVS, demonstrated that I'd had 2 shots, but I'm in an immunocompromised community. I'm a cancer survivor facing radiation therapy, got my booster. I want to do everything I can to protect myself, but more important to me is everything I can do to protect myself from giving the disease to anybody else, because I'm also a 2-timer with COVID, both times being hospitalized. And I want to emphasize to people, you should do what you need to do to help yourself, but more importantly, the loss of empathy I see in our community is really concerning to me. Please do what you can to help your loved ones, your neighbors, your community members. And another booster shot. It's the same risk, which is almost de minimis, more likely to die from lightning strike in a given year than from some complication with any of the vaccines. Please do what you can.
John, thank you for sharing that and for sharing your personal story. So this brings me to the question of, John, you said you just got your booster vaccine. So I'm curious, how is this going to roll out? Will there be a tiered system to the boosters? Will certain people be able to get boosters first? And so how will this roll out, and where will we be getting this?
So the rollout is actually implicitly rolled out now. You can go to your local CVS and click on schedule an appointment, and it has a menu item which says, I'm an immune compromised person, I would like an extra shot, and you just get it. Now, in terms of the government making sure that's available to everybody, there's a conflict right now between the Biden administration and the FDA. There's a little conflict about the rollout. The Biden administration would just like to make it available to everybody. The FDA is more interested in rolling it out, first the immunocompromised folks, and then later other folks. So there's a little bit of a debate right now. It will resolve one way or the other, but the boosters are coming, and I advise everybody to get them.
I think it will be a little state to state variation as far as how it's rolled out. I mean, San Francisco, well before this, kind of has started with people giving them a booster. So I think there will be some ability of states to be able to determine how that's rolled out. There are people I know that are not immunocompromised that have just gone for their 3rd booster. So they're not really enforcing it yet either. So.
Yeah, I think there'll be more information about how Connecticut will approach this later in the month.
Great. Thank you so much. So I need to ask this question because I think, Lisa, you had mentioned waning immunity. And so I'm curious, if we need boosters, does that mean that I am no longer safe just after my, 2 doses of the vaccine?
So I think right now it's going to be a personal decision for the 3rd booster. I mean, the data is continuing to evolve. Science is something that is fluid as we get more knowledge. But I think right now, some people might say, I feel that I got my 2 shots and I know that I am unlikely to have serious disease and hospitalization, and I'm kind of okay with that. I think a lot of other people would feel that they want to make sure that not only are they safe, but that, as John said, that we want to make sure that our fellow human beings are safe as well, and will not only opt for the booster for themselves, but to make sure that there's no chance of them being able to spread it to somebody who's immunocompromised or somebody who's not vaccinated yet. We still know that there's still a very small percentage of vaccinated people with breakthrough cases. I think the last I saw in Connecticut was of the 2.2 million people vaccinated, there were about 9,000 breakthrough cases. So that's not a huge number of cases. So we're doing this, somewhat for ourselves with the boosters, but we're also doing it we all kind of tired of this pandemic from a social point of view and an economic point of view. We want to get back to being able to hug our fellow friends and family in a restaurant. And so there's that reason to be able to do it as well.
Great. John, I want to go back to you, and I want to talk a little bit about some recent news. On August 23rd, the U.S. Food and Drug Administration approved the first COVID-19 vaccine, and that vaccine we know as Pfizer, and it'll be marketed under a different name. But does that full approval change anything with regard to the vaccines from a legal perspective?
Probably. Let me say, we're talking full approval. The vaccines had emergency use authorization. The federal government, the Department of Justice, had resolved that even under emergency use authorization, employers and others could mandate that their employees or students could have to have the vaccine. There was a little debate in the legal community whether the authorizing statutes supported that decision. That debate is now gone. Even though during that debate, only one judicial decision was a federal court in Texas said, no, employers can mandate emergency use authorized vaccines. Now it's got full vaccination status, full authorization status. There is no question that employers, universities, and the like can mandate the vaccine. So it's taken the question off the table. We can mandate that vaccine now without question.
And I would add that many people were hesitant about getting a not fully approved vaccine. They were worried that this vaccine was still kind of in the experimental phase, even though it had millions of doses administered in a very thorough and robust trial under its belt. But now that it has full authorization, it also removes from the table the concern that you're getting something experimental. And so people can feel fully confident that there's nothing experimental about this. And with millions and millions and millions of doses administered, we know all about the potential side effects, all about the many benefits. And so people should feel very confident about getting this vaccine safely.
Right. In effect, the largest clinical trial in history, right? 200 million nearly trial incidents. Yeah, fantastic. So absolutely. Thank you.
Less than a year. There's nothing, nothing like it. And that's just in the US.
Right.
Perfect. Thank you both. So John, I want to just follow up with a question. The Education Department announced Monday that it has opened civil rights investigations into 5 statewide bans on mask mandates to determine whether they discriminate against students with disabilities. The agency wrote that the prohibition of masks mandates may be preventing schools from meeting their legal obligations not to discriminate based on disability and from providing an equal educational opportunity to students with disabilities who are at heightened risk of severe illness from COVID. What does this really mean for us? I mean, what can we expect moving forward out of something like this?
Well, I think it's a movement towards recognizing that there are health conditions among children that render them much more susceptible to significant lung infection, especially due to COVID. So anybody with asthma, anyone with diabetes, even Down syndrome increases that risk. So this is a recognition that people who have these conditions, children who have these conditions, have a right, 1, to be in classroom, 2, to have an equal education with anybody else. And to do that, we need to make sure that their classmates are masked. So I think that the Department of Justice is correct in doing this. I think they will be successful. I hope that people will recognize that there are members of our community, especially children, who are much more susceptible to this ailment. And we can do this simple thing by wearing what is now a free mask, because you can go to any town hall in the country and get a free mask. One simple thing. I think it's important to recognize these children adults as well, but especially children who are immunocompromised or have health conditions that make them more susceptible to serious illness with COVID. And the way you, as a parent of another child, can make that better is just put a mask on your kid.
Great, John. Oh, go ahead, David.
Well, I'm sure Anne has her hand raised. So I'm going to let her speak to the importance of allowing kids to go to school. So
Yep.
wearing
Anne,
masks
go
is
ahead.
so important.
Well, I just think everyone has spoken about, the vulnerability of children. And the fact is that we've done other things to protect the one child from the many. There are so many, for example, nut-free classrooms where no child can bring any kind of snack that has peanuts or peanut butter or anything like that. And we've been willing to adjust to that because it puts the single child in that room in a compromised position. So this isn't anything new to us really in a classroom. It's simply really, as others have said, recognizing that we need to be empathetic to particularly those that are even more vulnerable from comorbid conditions that they have, and that they're in those classrooms with other children. And it really is quite simple. And children are pretty resilient. They've been wearing their masks and they've been fine with it. I know that people are concerned perhaps that it affects the overall learning environment. And we really don't know that right now. Right now, there aren't a lot of long-term studies or gold standard studies as to how much a mask will affect the learning process. But reasonably, and I have to say this from years of experience, teachers are quite creative and children are quite resilient. So there are many things that teachers are doing to work with mask mandates. Simple things like hand signals, which we've done all along really with children for feedback. For example, thumbs up or thumbs down, or I don't understand. And we've done that all along. So we can continue to do things like that, maybe use them a little more frequently because children have masks on. But the overarching concern of the health and safety of children far outweighs the learning piece when we can accommodate that learning piece in more creative ways.
I'd like to ask a follow-up question to Anne. I mean, we do know that masks provide some sort of frustration, but certainly the data are clear. And I'm talking about a person who lives in a house with a child psychiatrist, that learning by Zoom is much more challenging than learning in person with a mask. So it is the lesser of all possible evils, without question. Would you agree?
Agreed. And also some of the data we're getting, again, this is a whole new experience for us. So the data is somewhat limited, but recent data just from last year, in-person learning has far outweighed virtual learning across the board, particularly in mathematics. So we know that even with masks on, even with distancing, even with some of the challenges, children still learn better on the ground.
And I'm so glad you're here with us today, because I would imagine that we have a lot of people who have questions about vaccinations, COVID, mask mandates, safety in schools as it relates to their children. Schools have started or are about to start. And recently a story appeared in a report from the Center for Disease Control describing an outbreak of the Delta variant in an elementary school in Marin County, California, where a teacher became symptomatic, continued to work for 2 days. And during that time, she read aloud, she was unmasked. And there were I think the most compelling thing about the story was this was in a community that was a more affluent community, where the vaccination rates were higher than other areas within California. And there were other mitigation factors being used. Doors were open, windows were open. Nonetheless, 12 of the 24 students tested positive, with 80% of them testing positive who were seated closer to her. Our governor, Ned Lamont, I think Thursday afternoon, issued a statewide COVID-19 vaccination mandate for all public and private school teachers, stating our kids are going to be in school safely, our teachers will be able to teach safely, and we're going to be able to go to work safely. And this is what the rules are all about. And I think everyone on this panel has really talked about the importance of us doing things not only for ourselves, but mostly for protecting those around us who possibly can't get vaccinated or who are more vulnerable. So Anne, I want to get right to a question. What is the current guidance and the recommendations for protecting our children within schools?
Well, I think Connecticut has done a very good job of responding to this and knowing that, one, requiring teachers to be vaccinated, or in the case of exemptions for other reasons, to be tested regularly, so that things like Marin County don't happen, and that our children and all of the adults in the building are masked, that there is a 3-foot distancing between children for the most part when they're not outside, and that we can, as much as possible, hand hygiene, open windows, all of that. I think in following all of that, so far, I mean, not all the data is in, but the data seems to indicate that that is a perfectly reasonable way to keep everyone safe within the building. So to be honest with you, these states which are trying to ban masks in schools, it just makes very little sense to me as an educator and as someone who has protected children as an educator for her whole life. I just really don't understand what logic could be behind that. We put bike helmets on children. We put seatbelts on children. We put snowsuits on children when they go outside. All of these things are not exactly always what they want to wear or have on them. But it's a minority of children who really find the mask to be difficult, sensory, children who have sensory issues might find it. And we have found ways to accommodate that. But largely, most kids, if you're in a building, which I've been in recently, the kids have their masks on, they're jumping around just like regular kids, and they're not really paying too much attention. You have to kind of remind them to put it back up over their nose once in a while, but they pretty much have accommodated it in the same way they would accommodate bike helmets and any other kind of protective elements that we've asked them to do in the past. So there are ways to keep them safe, and we know what they are.
We should note that it wasn't a child who brought the COVID into the classroom. It was an unvaccinated teacher, which speaks to Governor Lamont's mandate that teachers receive the vaccine, and that it's not the children who are spreading it in that case. It was the teacher to the children.
Yes. David?
And an unvaccinated teacher. I mean, we have good data from elementary schools that even with an unvaccinated population, even with children sitting fairly close together, if they're wearing masks, it's very effective protection. So the message is, shall I say it again? Please be vaccinated, but also don't come to work if you feel unwell. And we've had this conversation in our own community at Quinnipiac that the Delta variant could, in a vaccinated person, could look more like a common cold than the true, fever and shortness of breath and cough. So if you're feeling unwell, please don't come to work, stay home. And certainly if you're in a setting like that, you have to wear your mask. I mean, just have to. And my 3-year-old grandson, he bops along in his preschool without any problems wearing a mask. I have to say, he looks very cute in it, but he doesn't seem to mind it at all. I think they're very used to it. So, yeah.
Great.
My wife, the child psychiatrist who consults with a lot of school districts, has reported one issue with masks and children, and that is they like to trade masks. They're fine wearing the mask, but the trading is an issue. So the kids embrace the mask as a pop culture, as an item of dress. The kids are fine with it. It's the parents who worry about them.
Got it.
If I could add, I saw a wonderful interaction. A dad and a little girl, like 5-6 years old, were about to go into the store, and he said, okay, we have to put on our mask now. And she says, I know, Daddy. She says, I'm a superhero. And he goes, what do you mean? And she said, superheroes wear a mask and they save lives. I got choked up. I mean, here's this little girl, giving us all a wonderful message.
Wonderful. I love that.
And
So
I think that, sorry.
Go ahead, Mary. Please, go ahead.
Be aware of is that for the pediatric population, especially children 5 to 11, who are currently not eligible for the vaccine, hopefully will be soon. The Pfizer and Moderna are looking at 6 months of data. They started in March, collecting data which is needed for the pediatric population, and we're waiting. We were thinking September, early October at the latest, as to what the recommendations are going to be for that age group. So, and that would be huge for schools, when children are able to be vaccinated to attend school.
Great, Mary. I'm so glad that you added that in. So basically what you just said was you are anticipating that there is going to be some emergency use authorization for children to get the vaccine aged 5 to 12. Is that correct?
Yep, 5 to 11. Right now it's 12 and up. So
All
that,
right.
that's school-age children when you think about those ages, which is great. And they are looking at children 2 to 5 and children 6 months to age 2. And that will be later in the winter.
Do you anticipate, Mary, that coming out at the end of this year or maybe leading into next year for the younger, the much younger?
Probably would be a little bit into next year, most likely. And
Right.
the other thing that we're looking at is the ability for children to be vaccinated in their pediatric offices, where they receive their primary care. So for children, they hopefully will be able to get their COVID vaccine and, have their flu vaccine in the same place.
Great. Great. Thank you so much. I am going to open this up. Because Mary, you got to your question about what we're thinking about vaccinations for children under 12. I'm going to open this up. Colleen is here, and we are going to start with some questions that were submitted up front from our participants and that have been put in the Q&A. Colleen?
Yeah, great. Hi, everybody. Thank you again, our panelists. I always get so involved just listening to you all and get excited. I love this story, Lisa, about the superheroes and the masks. That was terrific. We do have some great questions, and I want to bring them forward and figure out who wants to answer them. Remember that beginning of the pandemic, and I don't know about you all, but I think a lot of us were washing everything. And you went to the grocery store and we were wearing gloves, and we came home and we washed the bags, and we left things outside. So one of the questions in the chat was about research related to transmission of this virus. Is there anything new going on with contact with hard surfaces? So, can I get it from touching that countertop after someone else touched it? And I think that, we've come a little ways with this, and I wonder if there was anything new happening, and maybe Lisa could comment.
I think we've shown that is not the main mode of transmission between people. I don't think it's impossible to be able to say that somebody who has just, sneezed into their hands and now has, touched the countertop of the doorknob, and then we touch it and then touch our, eyes and touch our mucosal surfaces, that it's possible, but it certainly is not, something that is a high mode of transmission right now. I try to just teach people not to, touch their hands to their face still, more so than worrying about touching the surfaces.
Great, thank you.
And
I appreciate it.
let me just add to that. So as Lisa just said, the driving force for COVID is not surfaces. And the CDC earlier this year actually relaxed its recommendations on cleaning. So, we were all scrubbing in the classroom after you had sat there. So really routine cleaning of a public space once a day is sufficient, unless you have a documented individual with COVID in that space. Then you would clean after that individual. So routine hygiene is fine, but I'm no longer obsessive about, we left the stuff in the basement for a few days, and before we brought it up into our kitchen. So
right,
we can feel more relaxed about that.
Thank you, David. So speaking of feeling relaxed, football season's coming. I don't know if my Giants are going to do very well this year, but what's everyone's thoughts on these types of events? What do we think about attending a large scale event, a football game, inside, outside, big crowds? What's enough?
So the first part of that is I think I have been very happy to be able to see more and more of these types of venues saying you need to either be vaccinated or show a negative test. So I think that's a nice incentive that we can give to vaccinated people. And you're still giving the choice because most of them also allow a 48-hour negative test. So I think that's the first part of it is let's try to make that be something that's a reward for vaccinated people. And then David, I don't know if you want to talk about the second part.
Yeah, I mean, not all venues are going to be able to do that. If you've got 50,000 people going into Giant Stadium and watching the game, they're not going to be able to screen for that. And so personally, and I answered this, I think in the Q&A, if I were in a setting where I was cheek to jowl with people who were screaming and cheering and spewing forth their respiratory viruses, I'd probably wear a mask. Matter of fact, I would wear a mask in that setting. I just, do you have to if you're vaccinated? I just would feel a bit more comfortable about that. And I think a lot of the guidance is, in indoor crowded spaces, certainly you would do that. Even though you're outdoors, it's kind of crowded there. And so I would do that. Maybe someone can disagree with me on the panel, but that's what I would personally do.
And I agree. And some people, here know that I have an alternative life. I will be performing at the Americana Fest coming up in Nashville in September. And the Americana Fest has resolved that you have to have a vaccine and or a recent test. But in addition to that, I'll be wearing my mask everywhere except when I'm singing. But typically when I'm singing, it's not a problem because people cover their ears, which I think is helpful in preventing the transmission, right? Can you confirm that, Lisa?
Well, you do bring up, John, and I'm sure your singing won't make me cover my ears. You do bring up a good point, though, about more of these venues and even indoor dining, or someone asked about with mask wearing, how concerned should I be? I'm vaccinated and I've got my mask around, and then I'm indoors at something, concert, an event, or even Stop and Shop. And there's people that are unmasked. And I know that maybe they're not all, the requirement isn't such. So should I be worried about that unmasked person inside?
I wouldn't engage them in a long conversation.
Okay.
I mean, I wouldn't say that I dodge them when I go into stores. But I'd be careful, be sensible. So, if you're going in a store, I mean, generally the definition of a contact was both proximity and duration. So within 6 feet for more than 15 minutes and oftentimes without a mask. And that's not going to happen in a setting like that unless you're sitting next to them in that concert.
I'll just add the personal note. I dodge. I'm on to the next aisle in the supermarket. I'll come back around. I just don't want to deal with it. And frankly, it saddens me that people won't wear a mask. But no, I'm a dodger.
I think the fact that the person who's not willing to wear the mask is probably also the person that's not vaccinated makes me skeptical of that person to dodge as well.
Yeah, I appreciate that. I would agree with those comments as well. So let me move to the vaccination status. We talked a little bit about that. And we know we have the card now. You have your card and we've uploaded them here and other places. And there's a little bit of chatter going on with some folks, some of the younger people, that there's ways to get a fake vaccination card. So what do people think about it? Is there going to be a way to figure out if your vaccination card is legit before they allow you in? My son went to a concert last week and had to produce his vaccination card before he could enter. What do you think about that?
Well, I have both. I have a real and a fake. I went out and got a fake one. And I will tell you this, I think the fake one looks a lot more legitimate. We don't have any lamination. It's not like your driver's license where there's, secret code behind that only revealed in blue light or whatever, black lights. No, I think there's absolutely no way. And I think it's because of the failure of the government in recognition that a lot of people don't want to have these vaccine passports or what have you, to have a standardized methodology and some sort of secure methodology. We've all got these in our wallets or wherever. It's just a piece of cardboard that someone wrote on. It is really, really easy and you can get them for free. I didn't have to pay for my fake vaccine card. No, there's no way to distinguish.
And a lot of people are allowing a picture, and it's even easier to fake a picture. I can just change somebody's name to someone else's name. But there was a woman in Hawaii who was just arrested for her fake vaccination card, but she happened to spell Moderna incorrectly, and that's how she got caught.
Okay. Thanks
Yeah,
for that.
I use spell check on mine. I think I'm safe.
Good to know. We'll remember that. Some of the questions are coming through about testing. We haven't really talked about testing. We've been talking, we're vaccinated now, but we are still going for tests. So I've kind of two here. One, I'm going to put David on the spot because I think you mentioned it in, I think it was faculty town hall or the Senate, go out and get tested if you feel that you're symptomatic. So I do want to know when you think people should get tested if you're vaccinated, a little more guidance on that. And then also, I believe you mentioned the ready tests at CVS, the ones we could buy ourselves. And maybe you could comment on the efficacy or safety of the ones you can just buy and do at home.
So the gold standard is the PCR test, where we're actually looking for genetic material of the virus. And that's the one where you used to have the probe put way up in the back of your nose and coughed a lot when that happened. But just getting an anterior nasal swab is sufficient with that. So that's the gold standard. And the turnaround time, although it's probably slowed down a little bit because of increased use of testing, has been around 24 hours of that. And there are many sites, at least within our state, where you can get that for free. The home kits, they're pretty good. They're not looking at, unless you send it off back to the lab, they're not looking for the genetic material. They're looking for antibodies to the virus or other parts or antigens. They're looking at antigens, of the virus. And if someone is symptomatic, they're pretty good. So I would say that if you have symptoms consistent with COVID, and those may be just as simple as a cold, and those tests are negative, is it 100%? No, but I think it's a pretty good assurance that you're negative. So why test yourself? Test yourself if you are, contemplating staying home or going to work, you're concerned about that. Again, we don't want people going into a setting where they could spread it to others. So you may want to check yourself then. And if you're concerned for any other reason, maybe you're going to go visit an elderly relative or do something where you might potentially expose another individual, not just in the work or classroom setting.
I know a couple of weddings that happened just recently, and that's what people did. They kind of stayed home for the 3 or 4 days before the wedding. They did a self-test at home, and at least they felt like being in that environment. Everybody, it was a small wedding, and they were all going to do that, and they felt that was just adding one more step to try to make sure that the wedding could be done safely.
Great, Lisa, thank you. I have one more, and then we'll see where we're at. And anyone can try this, but I'm thinking of David a little bit as well. I know the CDC has released guidance about isolation and quarantine, and if you have your vaccination, if you're just exposed. So maybe recap it for folks. What is the guidance on quarantining and isolating if you're vaccinated versus not, and whether or not we need to do that, if you could comment.
Sure. So if you have COVID, whether or not you're vaccinated, you need to isolate for 10 days. And if at the end of that 10 days, you are feeling well and your symptoms, if you had symptoms, have abated for 24 hours or more without using fever reducing agents, then you can go back to whatever you were doing. If you are exposed to an individual, so you're a contact and you are unvaccinated, you deemed to be a true contact, you need to quarantine. Now, historically, that was 14 days, but at least at Quinnipiac, the data shows that you can quarantine for 10 days if you test at 8 days and you test negative. So we have a test out of quarantine procedure at Quinnipiac. If you're exposed, unvaccinated, you quarantine for 10 days and we'll test you at 8 days. If that's negative, you can leave quarantine. If you're vaccinated, you don't need to quarantine. You don't need to remove yourself, quote unquote, from the community. You should, however, wear a mask in basically all settings and do that for 14 days unless you get tested. And the recommendation is that you get tested at 3 to 5 days. So if your test at 3 to 5 days is negative, then you don't need to quarantine anymore. So unvaccinated, quarantine for 10 days and generally would test out of that. If you don't test, then you probably should do it for 10 to 14 days. If you're vaccinated, you don't need to quarantine. You should wear a mask and then be tested at 3 to 5 days.
David, thank you so much. I do want to end, I think, on two questions, one that was submitted up front, and it has to do with the likelihood we'll see booster shots this academic year, which I think we know that the booster shots will more likely than not be available here very quickly. John has already taken one. But the question is, how will this affect current campus policy, if at all?
So in terms of the booster shot, my guess is that most of our students who became vaccinated were vaccinated more recently. So they were probably vaccinated towards the end of the last semester. And really, there's no reason to consider a booster shot before at least 6 months. We were talking about 8 months, but it's decreased a little bit to 6 months. So many of our students might, quote unquote, not be eligible. And so I don't want to convey the message that every one of our students has to be boosted for their vaccine. I think we can go through the semester perfectly safely with the 2 doses of Pfizer or Moderna, the single dose of Johnson & Johnson, without getting boosters. So let's see how it's rolled out, whether or not we're going to make a policy or try and encourage our students to get their boosters. I think it may be rolled out kind of partially, that we'll pick the highest risk individuals first. So those, as John has mentioned, are immunocompromised. Maybe it'll be our healthcare students who did get vaccinated fairly early on. Maybe it'll be our teachers, our student teachers who are going into the classroom setting, and then open it up for others. But I don't feel a huge pressure to get boosted in our academic community, because there are all the other things that we're doing to try and mitigate the effects of COVID.
Great.
Can add, there is a movement among the employment community. A number of employers across the country, this conversation, are considering requiring boosters for their employees who were vaccinated 6 months or more ago. So I think it's coming in other contexts.
So John, this is interesting. I went out to dinner last night, went to a restaurant. The restaurant asked me for my proof of vaccination, so I pulled my card out. So what you're saying, John, is they may be looking for the booster as well?
Yeah, I think that's on the way. Debatable, but I think given the current status of the Delta variant, the numbers of people infected and people hospitalized, I suspect that that's the next step, unless everybody goes out and gets vaccinated and we put this pandemic to rest. But my prediction is that's on the horizon, that a number of communities, employers first, but I think universities next, if we don't, as a overall national community, buckle down and vaccinate. I think it's coming. Yeah.
Yeah.
So,
I mean, I would just say that the way to deal with this, I mean, the same people who got the vaccine initially are going to be the ones who get the boosters, and not every one of them is going to get it. So if we want to actually deal with this, it's not really through boosters, it's through getting that extra 10, 20% of people. Janelle mentioned it's up to around 65 to 70% in Connecticut. We've got to get it up to 80, 90%. And that's what's going to make the difference.
Good point. I do have one last question about the booster that I forgot to ask earlier. Does the booster need to be by the same manufacturer? So for example, I'm vaccinated with Moderna. So does my booster need to be Moderna, or will it be a Pfizer booster?
So the FDA hasn't really come out officially with that yet. And some places like San Francisco kind of decided it on their own based on kind of data coming in from other countries that people had gotten Johnson & Johnson or AstraZeneca were then able to get the Pfizer or Moderna. But I think that the likelihood is going to be that they recommend that you get the same vaccine that you originally got.
Great. We are closing in here on the end. Mary, David, Lisa, John, and Ann, thank you so much for being here. I do want to say a couple of points that you made along the way here. You really highlighted do the things not only to protect yourself, but more importantly, do the right thing to protect those around us, particularly those who are vulnerable, who aren't able to be vaccinated. This isn't just about us. This is about the community we're trying to protect. Get vaccinated. If you're vaccinated, get your booster. And when you get your booster, get your flu shot. Thank you so much once again to our panelists and our participants present today. Please join us in the future as we continue our conversations on behalf of Quinnipiac University, the School of Health Sciences. We wish you all health and wellness. Be safe, be well, and go Bobcats.